Diabetes is a disorder in which the body has difficulty in regulating its blood glucose levels. Dr. Mertz, Director USDA Human Nutrition Research Center noted in 1959, type 2 diabetes is not a disease. It is the lack of a natural ingredient, known as GTF chromium. GTF chromium CR3+, is an essential trace element which helps insulin metabolize fat, turn protein into muscle, and convert sugar into energy. The progression of diabetes can be well controlled by pharmacotherapy, dietary control, exercise along with GTF chromium as adjunctive therapy. Pharmacotherapy generally, the oral medications available in the market function to inhibit the liver from releasing too much glucose, enhance insulin secretion or slow down the digestion of carbohydrates. While insulin therapy is a treatment of diabetes by administration of exogenous insulin. The main function of both oral medications and insulin treatment are to reduce the blood sugar levels in diabetics. Therapeutic effects of oral medications and insulin treatment in short term is significant, but long-term medications will cause various side effects such as liver damage, impaired pancreas function and kidney complications. Dietary control for diabetics is always the key management. The complex carbohydrates as well as glycemic index and serving size of food should be taken into consideration into your diet. The main purpose of dietary control is to maintain an ideal and healthy body weight, regulate blood glucose level and achieve nutritional balance within the adequate amount of calories intake. Exercise enhances the sensitivity of cells towards insulin and helps in maintaining blood glucose levels. Besides, exercise can greatly reduce the risk of getting diabetic complications. 45 minutes of walking daily is recommended as the optimal exercise for diabetes. However, diabetics need to closely monitor their blood glucose levels in order to have a detailed understanding of the impact of exercise on their blood glucose regulation to avoid hypoglycemia. However, although you had practiced the above-mentioned management, sometimes the result would not be very significant and effective due to the imbalance between pharmacotherapy, dietary control and exercise. Wrong method of practice such as overdose of insulin, not taking medicines as prescribed, skipping meal, unbalanced diet, or not exercise regularly may interfere the result. Therefore, GTF chromium as adjunctive therapy works in a more natural way and targeting the root cause of diabetes to control blood glucose level by enhancing insulin action and uptake of glucose into the cells. GTF chromium is the biologically active form of trivalent chromium CR3+. One of the most crucial part in diabetes management is to replenish the GTF chromium content in our body. Trivalent chromium is one of the main component of glucose tolerance factor (GTF), which was discovered by Dr. Walter Mertz in early 1957. Study showed that patients with type 2 diabetes have lower serum chromium levels than normal people. Morris et al., 1988. Besides, the trivalent chromium content in our body will be gradually reduced as we age. Davies et al., 1997. For those who are obese, pregnant, alcoholic, workaholic and under excessive pressure, the loss of trivalent chromium is even more severe. Lack of chromium reduces insulin sensitivity, thereby reduces the uptake of glucose into cells for energy generation. As time passes, retention of glucose in blood vessels may lead to the development of diabetes. Moreover, high blood glucose may cause hyperinsulinemia, which has a direct relationship with hyperlipidemia, atherosclerosis, obesity, hypertension, coronary heart diseases, stroke, etc. Lots of studies show that replenishing chromium can reduce blood glucose level, total cholesterol and triglycerides. Chen, W.Y. et al., 2008, thereby improving diabetes complications. However, food contains only little quantity of trivalent chromium and dietary fiber will combine with chromium and excrete it via feces, thereby affecting the absorption of chromium. Professor Dr. Frank Mao Chia Hung, a Ph.D. in endocrinology and expert in dairy products, discovered that colostrum in mother's breast milk contain lactoferrin chromium, which is the most absorbable form of trivalent chromium. In year 1999, Professor Mao and his research team has achieved a biotech breakthrough of a special formulated GTF milk which is closely identical to mother's breast milk. Benefits of Gtfmilk: contains lactoferrin chromium with higher absorption rate, enhances body metabolism, increases insulin signaling, enhances glucose uptake into cells for energy generation, regulating blood glucose level, blood pressure and total cholesterol, and improves insulin resistance. Therefore, it is vital to ensure good glucose metabolism via good insulin receptor signaling. Good cell. Good health.